Hi everyone, this is Wayne from the Alchemical Tech Revolution YouTube channel. Tonight we're going to discuss a little paper here called Nanorobot Hardware Architecture for Medical Defense, and this was actually published in mdpi.org/sensors back in May of 2008. That's what this is. MDPI, for those not familiar, is a publication platform, and that stands for Multidisciplinary Digital Publishing Institute. And what this is actually a peer-reviewed source where people who develop these different papers or these different experiments and things like that, they could put their research on this platform. They pay to put their research on this platform for other researchers out there. So it's a data sharing type of a site, and it is an accredited peer-reviewed journal. So what this is a research paper, and like I said, the title of it is called Nanorobot Hardware Architecture for Medical Defense. So we're going to take a look at that, and we're going to talk about the implications from this 2008 paper and how it pertains to things we're looking at today. So let's read right here from the abstract. And remember, this was published May 6th, 2008. Abstract. This work presents a new approach with details on the integrated platform and hardware architecture for nanorobots application in epidemic control. Listen to that, guys. Which should enable real-time in vivo, and that means within the body, prognosis of biohazard infection. The recent developments in the field of nanoelectronics, with transducers progressively shrinking down to smaller sizes through nanotechnology and carbon nanotubes, are expected to result in innovative biomedical instrumentation possibilities with new therapies and efficient diagnosis methodologies. The use of integrated systems, smart biosensors, and programmable nanodevices are advancing nanoelectronics, enabling the progressive research and development of molecular machines. It should provide high-precision, pervasive biomedical monitoring with real-time data transmission. The use of nanobioelectronics as embedded systems is the natural pathway towards manufacturing methodology to achieve nanorobot applications out of laboratories sooner as possible. To demonstrate the practical application of medical nanorobotics, a 3D simulation based on clinical data addresses how to integrate communication with nanorobots using, get this, RFID, mobile phones, and satellites applied to long-distance ubiquitous surveillance and health monitoring for troops in conflict zones. Now listen to that, folks. They're rolling this out first as a military innovation, okay? And this is how this stuff always starts with the military-industrial complex. They always weaponize this stuff first. But they're talking about actually putting nanorobots inside a person's body and tracking it through RFID, through mobile phones, and through satellites. Therefore, the current model can also be used to prevent and save a population against the case of some targeted epidemic disease. There you go. And that's just right out of the abstract for this paper. Let's read down a little further. The development of nanorobots is a technological breakthrough that can enable real-time in vivo prognosis. In vivo, folks, just as an aside here, means within the body. Prognosis for application in a variety of biomedical problems. Particularly interesting is the fact that medical nanorobots should also provide an effective tool for defense against biohazard contaminants. See that? See what they're doing here? They're setting this all up. This paper presents the use of nanorobots with embedded protein-based nanobiosensors, providing a practical molecular machine for medical defense technology. Listen to that term very carefully here, folks. Medical defense technology. You're going to start hearing about that real soon. Normally, for areas in public calamity or conflict zones, the absence of drinking water or any sort of fuel, electricity, and the lack of towers for network communication, including cable and wireless telephony, is a constant. Now, just as an aside here, for everybody that's listening here, the absence of drinking water, any sort of fuel, electricity, lack of towers, network communication, cable, wireless, etc., etc. This is kind of a veiled reference that they're planning on taking down the power grid at some point, just for anybody, who wants to read a little bit between the lines there. In such a situation, the available infrastructure is far from ideal to enable a large-scale medical laboratory with precise and fast analysis. For such aspect, nanorobots integrated with nanobiosensors can help to transmit real-time information using international mobile phones for wireless data transmission through satellite communication. In fact, nanorobots should mean an efficient and powerful clinical device to provide precious biomedical monitoring, both for soldiers as for civilian population. There it is. There's the confirmation there, folks. This is not just for military use, not just something they're using per se for military personnel or soldiers. This is meant for the civilian population. Therefore, the architecture presented in this work can help to address the development of just-in-time accurate information, protecting lives in urban areas against biohazard materials. So there you go. In that last paragraph, we see they're preparing for the situation where the power grid is down, and they don't really have efficient means of tracking or monitoring the spread of disease or epidemic or pandemic or anything of that sort. So they plan on somehow using these ubiquitous nanosensor robots to monitor people's health in real time and protect people through various means of probably locking them down where they're at and not allowing them to leave if they have something that they test positive for with these nanosensors that they plan on using for this. So that's what we're looking at here, folks. I mean, this is real, Orwellian stuff when it comes down to it. But let's continue on. The proposed hardware architecture aims the use of medical nanorobots as an integrated platform to control contagious epidemic diseases. Okay, do you see where this is going yet? Details on communication required for surveillance assistance and the integration platform to interface long-distance monitoring with nanorobots are also given through the paper. Thus, the present model serves to help monitoring contagious diseases, which in practical ways should protect personnel on patrol access across conflict areas or during humanitarian missions. There you go, humanitarian missions. There's that, once again, veiled reference that this is going to largely affect civilian populations. Furthermore, an important and interesting aspect in the proposed architecture is the fact that the same technique can be useful for other situations, like natural catastrophes or possible biohazard contamination, helping against pandemic outbreaks. There it is, right in black and white in this paper, folks, when time and fast information is a key factor for public management. And notice those terms, public management. Just to read between the lines a little further with this, what you're looking at here is really the plan when it comes down to it. This is what they're working towards. This is why, they're trying to get everybody so hooked on these pocket devices like your cell phone and things like that. It's a surveillance platform, but see, it's going to be, upgraded to the next level here very soon. And they're using this whole pandemic situation as an excuse to do so. So let's continue on here and see what other gems this little paper, has to tell people. To visualize how stages of the actual and in development technologies can be used to biohazard defense, the nanorobots are applied to detect influenza inside body based on blood flow patterns and protein signals. The nanorobot architecture and integrated system are described, and the nanobiosensor is simulated based on electrochemical properties for digital analog sensor activation. Therefore, the work developed is also useful as a practical methodology for control and equipment design analyses. And there you go. And if we go back, in that paragraph to where this talks about how this technique can be useful for quote-unquote other situations like natural catastrophes or possible biohazard contamination, helping against pandemic outbreaks, etc., etc. When you look at that, what this is admitting is this is what they call a dual-use technology, and that's a very important term that you're going to be hearing much more about in the coming months, because most military applications of things are what are termed dual use. So not only is it a weaponized system, but they've also figured out various other modalities for use for it within the civilian population and within the public sector. And that's what this is talking about. This is going to be a dual use technology. So what they're going to do is use it for this medical application for the public so that they can monitor people. And let's read a little bit more about that, because this goes into some other interesting facets here within the paper. Let's continue on. The defense industry should remarkably benefit from achievements and trends on current nanobiotechnology systems integration. Such trends on technology have also resulted in a recent growing interest from the international scientific community, including medical and pharmaceutical sectors, towards the research and development of molecular machines. Medical nanorobots. Let's read about this. The research and development of nanorobots with embedded biosensors, with embedded nanobiosensors, let's be accurate here as to what we're reading, and actuators is considered a new possibility to provide new medical devices for doctors, as integrated control mechanisms at microscopic environments differ from conventional control techniques. Approaches using event-based feed-forward control are sought to effectively advance new medical technologies. And let me kind of translate a little of the gibberish for you there, folks. Event-based feed-forward control, this is talking about cybernetic applications. This is cybernetics. They're talking cybernetics. They're talking about feedback loops. That's what this is. It's a feed-forward feedback loop. So this is an input device to create a feedback loop. So what this generally does, when you create a feedback loop through an input device, what that's called is a causal circuit. And what this causal circuit does is hijacks a system and gives you control over the system. So this is what they're talking about, just to try to simplify it a little bit for people. So this is cybernetics through and through. This is what this whole science is all about. Okay, back to the paper now. So, in the same way the development of microelectronics in the 1980s has led to new tools for biomedical instrumentation, the manufacturing of nanoelectronics will similarly permit further miniaturization towards integrated medical systems, providing efficient methodologies for pathological prognosis. The use of microdevices in surgery and medical treatments is a reality which has brought many improvements in clinical procedures in recent years. For example, among other biomedical instrumentation, catheterization has been successfully used as an important methodology for heart and intracranial surgery. Now, the advent of biomolecular science and new manufacturing techniques is helping to advance the miniaturization of devices from micro to nanoelectronics. Sensors for biomedical applications are advancing through teleoperated surgery and pervasive medicine. And this same technology provides the basis for manufacturing biomolecular actuators. A first series of nanotechnology prototypes for molecular machines are being investigated in different ways, and some interesting devices for propulsion and sensing have been presented. More complex molecular machines or nanorobots having embedded nanoscopic features represent new tools for medical procedures. So, what this is telling you, folks, is these devices, they're very real. They do exist. Nanotechnology is a real thing. It's not a farce. They are capable of making these very, very tiny machines that can move about and do different things that they could remotely control. So, make no mistake about it. This isn't conspiracy theory. This isn't science fiction. This is real stuff going on. This is things that they can do and are doing in laboratories around the world. So when people tell you nanorobots, there's no such thing. That's all conspiracy theory. It's science fiction. It's all a put up or whatever they're saying. They're mistaken. They've been using nanotech in a lot of different applications for many, many years now. And nanorobots are a real thing. And, this one paper here in and of itself is proof positive of that. And there are many other papers very similar to that that'll spell that out for you if you go looking at it. But Let's take a look at the further scope of what this paper is talking about. Motivation. Worldwide infectious and microbial diseases account for approximately 40% of the total 50 million annual deaths. Considering the contagious properties of biohazard materials, they mean a serious threat that can affect a whole population, especially for metropolitan areas, where a contamination can spread extremely fast. Dealing with such a problem, time is a major issue. Although traditional methods for clinical analysis of contamination is useful to positively identify if a person was infected with some sort of virus, this laboratorial process demands a precious time and a complex infrastructure. However, for conflict zones, such infrastructure is often not easily accessible. Taking from the moment of infection, some contagious diseases may show the first symptom after hours, a week, or longer time, like years or even decades. It means, for example, that when the public authorities noticed the infection from a contaminated person showing external symptoms, a virus had enough time to spread itself through a circle of friends and workmates of the infected victim. Meantime, those mates were adversely driving the virus forward and had started a catastrophic chain circle. The use of nanorobots with embedded nanodevices for real-time epidemic control as lab-on-a-chip can be useful to avoid serious contamination with large proportions. In fact, it can help save a large part of a population in terms of fast evacuation and effective patient quarantine. Thus, it should enable a more effective action against biohazard materials. Were you paying attention there, folks? Embedded nanodevices for real-time epidemic control, a lab on a chip, could be useful to avoid serious contamination with large proportions, help save a large population in terms of fast evacuation and, effective quarantine procedures. This is the next step in things. That's what they're talking about here. This is next level contact tracing when it comes down to it. If you guys are familiar with what's been going on with all the talk of contact tracing and how, they want to track your location, and if you came in contact with a person with, say, COVID or whatever else they're trying to contact trace you for, and they hired all these people to do this job. Well, here's the truth of the matter, folks. That's going to be a very short-lived job for these people because it's all going to be done by AI very soon. And it's all going to be done in, a more perfected way than just, this guy was here, and they take the hearsay of I was talking to this one, and they trace their cell phone location to that place. Now they'll be able to actually tie your actual physical being directly to this stuff with these nanorobots. So this is next level contact tracing. That's what's being discussed in this paper here. And keep in mind, this paper was published in 2008 and is actually based on technologies older than that. So if that gives you an indication how long this stuff's been going on and just how detailed all this planning has been, it's really eye-opening. So I don't know how anybody could look at this stuff and say, oh, that's all just conspiracy theory. It's just a coincidence. Just a coincidence. How many more friggin' coincidences do people have to see to put two and two together and figure out there's planning involved? It's not a coincidence. It's not just random happenstance. This stuff didn't just happen by accident overnight, and then all of a sudden we just so happen to have to take all these steps and do all these different things just to kind of contain this oh so deadly virus with a 99.98% survival rate. It's ridiculous on the face of it when it comes down to it. But this is the narrative they're pushing. These are the technologies they plan to use to put in place this artificial intelligence control system, this control grid that's coming. And make no bones about it. It's coming. It's already here. It's just a matter of implementation of these things when they decide to roll it out full term without being covert about it anymore, without trying to get the people's consent about it anymore. This is what it's all about. Let's read a little bit further down here. We implemented a system simulation and architecture of nanorobots for sensing the bloodstream, targeting biochemical changes against pathological signals. Actual advances in wireless technologies, nanoelectronic devices, and their use in the implementation of nanorobots applied to epidemic control illustrate what upcoming technologies can enable in terms of real-time health monitoring. See, there you go. This is much more than monitoring people to see if they're sick with this particular virus or something, folks. This is real-time health monitoring. They want you wired to the grid 24/7 every single day of your life from cradle to grave. Total absolute control over your body, mind, and soul. That's what this is leading to. That's what they want to do. They want you implanted with these devices so that at the flick of a switch, they could, produce whatever result in you they want. Because that's the next step when it comes to these ubiquitous nanosensors and stuff like that. Not only can they monitor, your overall health and things like that with these, but once again, it comes into play this whole dual use aspect of these technologies. So they could implement different effects with these other than just sensors, just using them to monitor different responses and things. And if they're monitoring responses, they know what causes certain responses. So they can manipulate those things to get desired responses as well. So keep that in mind. But anyway, back to the paper. So let's read down a little further here. The approach for in vivo monitoring chemical concentrations should also apply to other biomedical problems and likewise be useful for prognosis of complex diseases and pharmacokinetics control. Furthermore, in the proposed platform architecture, different programs and commands can be sent and information retrieved from inside the body through wireless communication, providing important aspects on interface and medical instrumentation of nanorobots. So next we'll go to section 2.3 of this document here, prevention and control. Guess who has their fingerprints all over this, folks? You'll hear in the very first phrase in the next sentence. The World Health Organization has started in 1948 the initiative to implement a worldwide identification of new influenza viruses. Currently, demand for vaccines and effective ways to quickly manage and fight a pandemic outbreak are enormous, which also motivated the WHO, or the World Health Organization, to develop the Global Outbreak Alert and Response Network, enhancing the world's collaboration in containment of infectious diseases. Some highly contagious germs, such as SARS, severe acute respiratory syndrome, smallpox, and influenza, can bring deadly consequences and spread easily across borders and among populations from different countries. In face of international security, demand for defense against new threats driven by possibly biohazard outbreaks, the current $13 billion global vaccine business should grow 18% a year to $30 billion by 2011. Okay, remember, folks, this paper was published in 2008. Back then, $13 billion a year business, the vaccine business. And it's admitted right there. It's a business. Okay? Let's make no bones about it. And they were saying an 18% increase by year 2011. To $30 billion, which it's far surpassed that now. Excuse me. Anyway, back to the paper here. The concern to avoid personal losses has also motivated the implementation of periodical crew immunization of U.S. Navy against influenza and other plagues as surveillance and safety action. The concern in this matter, in order to save and protect lives, help us to understand how important it is to improve population-wide disease outbreak detection, preventing any pandemic onset. In fact, a pandemic influenza outbreak would likely cause the most severe vaccine shortages to date, with global consequences. So there they go, touting the vaccine as the magic bullet, the cure for these diseases, when in fact vaccines induce more disease than they protect people from. And, that's not a bold statement either. That's the truth. Vaccines cause more, especially immune disorders and things of that nature in people than what they protect from. So, notwithstanding that improved drugs and vaccines have evolved a lot, antimicrobials are of limited usefulness due to the following aspects: antimicrobial resistance to drugs and antibiotics, the large number of possible microbes that can be used for weapons. Listen to that. The microbes that can be used for weapons. That should be very telling, too. And limitations in technical feasibility for developing vaccines and effective antibacterials against certain germs. What kind of germs? Maybe coronaviruses? Therefore, in recent years, a crescent concern and interest has emerged for methods to efficiently protect people's lives, not only through immunization, but also, and even more accurately, through advanced real-time biomolecular in vivo virus detection. In vivo means in the body, folks. An efficient biohazard defense system should address frequent collection of data, fast information transfer, early signature of the outbreak, immediate analysis of incoming data, and immediate output. What's this talking about? Efficient biohazard defense system? What? Frequent collection of data, fast information transfer, immediate analysis of incoming data, immediate output. This is the 5G network, folks. On such aspects, the current trends on new nanobiosensors and miniaturization of micro to nanoelectronics open new possibilities with the development of medical nanorobotics for the implementation of efficient biohazard defense systems. And then this paper goes on and on. It shows like some of the technical aspects of this and some diagrams and talks about, some of the different very jargon-like language that they use to describe what these nano devices will do and how they'll work, and all of that kind of thing. It's an extensive paper. It's quite a few pages, probably about 10 or 12 pages altogether. So if people want to look through it, there's a lot there. And it talks about all of these different ideas within there. And let's just scroll down to another important part of this paper. We'll go down to section 6.4, data transmission. The application of devices and sensors implanted inside the human body to transmit data for a person's health care can enable great advantages in continuous medical monitoring. There you go. This is not just for the prevention of, say, an outbreak of a particular pandemic, folks. This is a long-term thing. This is continuous medical monitoring. They're spelling it out in black and white here for people, okay? So if anybody wants to call me a conspiracy theorist or to tell me to put my tinfoil hat back on, well, take off your own damn mask first and open up your ears and pay attention now, because this is where the rubber meets the road, folks. Like, this is the real stuff. It can also provide an innovative tool for accurate and in-time prognosis of contagious diseases. Most recently, the use of RFID for in vivo, there's that word again, meaning in the body, in vivo data collecting and transmission was successfully tested for electroencephalograms. For communication in liquid workspaces, depending on the application, acoustic, light, RF, and chemical signals may be considered as possible choices for communication and data transmission. Chemical sensing and signaling can be quite useful for nearby orientation and communication purposes among nanorobots. So not only are they going to communicate, say, to satellites or to your cell phone or anything like that, they're going to communicate with other nanorobots, which will be also in your body and probably in other folks' bodies too. Acoustic communication is more appropriate for longer distance communication and detection with low energy consumption as compared to light communication approaches. Although optical communication permits fast rates of data transmission, its energy demand makes it not ideal for medical nanorobotics. Works with RFID have been developed as an integrated circuit device for medicine. Using integrated sensors for data transfer is the better answer to read and write data in implanted devices. There's another veiled admission there, folks. Not only are these sensors to read data, but read and write data in implanted devices. So they could change the data in the implanted device and cause it to do a different output. So it's not just sensing, it's not just a sensor per se. It's a dual use device. It could be used to cause an effect. So there you go. Let's continue on. Thus, the nanorobot should be equipped with single-chip RFID CMOS-based sensors. CMOS with submicron SoC design addresses extremely low power consumption for nanorobots communicating collectively at longer distances through acoustic sensors. For communication, as well as for navigational purposes, the use of nanoacoustics for nanorobotic interactions can effectively achieve resolutions of 700 nanometers. For data recognition, the acoustic phonons scattered from the origin should be propagated at sufficient distances, and the acoustic wave field should be measured by diffraction propagation. For the nanorobot active sonar communication, frequencies can reach up to 20, I don't know what that is, at 8 hertz at resonance rates of 3 with a 3-volt power supply. So, what's this talking about? Once again, this is working off of the whole concept of the 5G towers, or the communication, the network's communication. This is going to actually set up microacoustic fields to transmit data between these nanorobots, and could be used to send these signals to a cell phone and through a cellular network. That's pretty much what it's about. And that also explains the need for these 5G technologies to have so many transmitters and relay stations and things of that nature. Because, as you see, these are short distance acoustic rates that they could do these with. Okay, let's go down here. More widely accepted and usual than an RF CMOS transponder, mobile phones can be extremely practical and useful as sensors for acquiring wireless data transmission from medical nanorobots implanted inside the patient's body. There it is, folks. It doesn't get any plainer than that. Cell phones can be a good choice for monitoring predefined patterns in various biomedical applications, such as helping in ubiquitous healthcare for real-time influenza detection. To accomplish that, chemical nanobiosensors should be embedded in the nanorobot to monitor alpha Naga levels. The nanorobot emits signals to send an alarm in case of detection of any alpha Naga protein overexpression, denoting when a person was contaminated with influenza. For nanorobot passive data transferring, approximately 4.5 kilohertz frequency with approximately 22 US delays. I don't know what the US, that symbol there means. It's something to do. Maybe some of you guys could look through this paper and tell me if you're familiar with the telecommunications and stuff like that. Delays as possible ranges for data communication. In our molecular machine architecture, to successfully set an embedded antenna with 200 nanometer size for the nanorobot RF communication, a small loop planar device is adopted as an electromagnetic pickup having a good matching low noise amplifier. It is based on gold nanocrystal with 1.4 nanometer CMOS and nanoelectronic circuit technologies. Frequencies ranging from 1 to 20 megahertz can be successfully used for biomedical applications without any damage. There's the key, folks. There's another veiled reference, without any damage. That's not to say they can't, amp up those frequencies to higher than 20 megahertz, and that would cause damage. So that's telling in and of itself. There's the implications for this are pretty staggering when you really think about it. So, this is what we're talking about. This is actual stuff going on. These are technologies that are in development right now that have probably been in development for at least the past 30 to 50 years. They could do a lot more with this than what they're even saying here. Because a lot of this stuff is, they make these veiled references here in this stuff. But as you go down further through the paper, it describes a little further how these things work and how the different simulations they used have shown that this is feasible. And let's go down to the bottom section here and see. Okay, we'll jump down to section 12 here, conclusions and outlook. This work used a 3D approach to show how nanorobots can effectively improve healthcare and medical defense. Nanorobots should enable innovative real-time protection against pandemic outbreaks. The use of nanomechatronics techniques and computational nanotechnology can help in the process of transducers investigation and in defining strategies to integrate nanorobot capabilities. A better comprehension about the requirements a nanorobot should address in order to be successfully used for in vivo instrumentation is a key issue for the fast development of medical nanorobotics. Details on current advances on nanobioelectronics were used to highlight pathways to achieve nanorobots as an integrated molecular machine for nanomedicine. Moreover, based on achievements and trends in nanotechnology, new materials, photonics, and proteomics, a new investigation methodology using clinical data, numerical analysis, and 3D simulation has provided a nanorobot hardware architecture with real-time integrated platform for practical long-distance medical monitoring. Real-time, long-distance medical monitoring by a little device implanted in your body, folks. What does this sound like to you? This model can enable nanorobots as innovative biohazard defense technology. And there's the rub right there. It's for the greater good, guys. Don't you want to, make sure your friends and family are safe and they don't get sick? You're a grandma killer if you don't wear the mask. You're a grandma killer if you don't take the injection and let them put the medical nanobots in your body so they can make sure you're not sick and not killing people. Do you see where this is going? This is what it's about. I mean, I don't know what else I have to tell people and what else I have to show people for them to realize this is not woo-woo stuff. This is not conspiracy theory. This is not science fiction. This is not my imagination. This is not me being paranoid. This is not me being a Looney Tune. This is real science, real peer-reviewed science. These are real technologies that do exist right here, right now, that are being implemented in ways that the public is largely not aware of. So that's where we're at right now. So as you could see, this is actually the architecture for, next level contact tracing. That's what's coming, guys. I mean, they're going to use this whole contact tracing ideology to get you, familiar with the idea first. And then they slowly and gradually shift the Overton window to get you to accept more and more invasive technologies and more invasive means of surveilling you day and night, 24/7, from cradle to grave. And, including giving them dominion over the control of your body. And that's what it's about. And that's what this whole mask thing is signaling. When you're putting on that mask, you're consenting for somebody else to have dominion over your body. That's what it is. You're giving up your free will to somebody else, to somebody, to an authority figure. And we need to not bow down to this stuff and let it roll over us. We're at a critical time here, folks. It's rolling out fast. It's coming down on us. There's no more time to just wait in the wings and see what happens. Now's the time to speak up and stand up. Be brave. Tell them no. Remove your consent from their system, because their system is nothing but a total panopticon control grid. And that's not a place I want my children to have to grow up in. So, when it comes down to it, we could stop this now by just calling them out for the blatant nonsense that's going on. Like with this whole mask thing going on, how they're mandating everybody's got to wear masks, and they come out with all these fake numbers and say, this many people died today in Florida and this and that, and we need to stop the spread of this, we need to shut the country back down again. In the meantime, they're destroying the economy. They're getting people, on the hook for this universal basic income kind of idea. They're rolling out all these plans all together. And ultimately, this nanotech, folks, this will be linked directly to your bank account. You'll have a social credit score attached to it. You won't be able to buy or sell. Make no bones about this. This is an actual thing going on. This is not just some religious hokum, okay? The beast system, it's real. It's here. It's rolling out in front of your eyes. Wake up. Stand up. Speak out. Say no. remove your consent from the system. They can't do this anymore. They can't roll it forward. If enough of us stand up and say, hell no, we're not going to do this. We're not going to let this happen. But it needs to start now, before it's too late. We need to say no to something easy, like a friggin' face mask. Because if you're not saying no to a face mask, you're not going to say no to a vaccine. And you're not going to say no to an identification card. And you're not going to say no to an implanted microchip or something to that nature, so that you could go buy your food and continue to exist in this world. You're not going to say no to that. If you can't say no to something easy like a mask, when the only thing you'll get is maybe a little bit of social ostracization. You might get a sideways glance at the grocery store or something, or somebody say, "Where's your mask?" If you can't deal with that, there's a problem. Now's the time to stand up, say no. We can't allow this stuff to go on anymore. And I, for one, am tired of it. And, we all need to start speaking up like this and saying this stuff. It's the elephant in the room, folks. Let's not mistake it for, anything else. It's the real elephant in the room. And it's blatantly obvious to anybody who has an eye to see. There's just no denying it. Everybody inherently knows there's something wrong with this whole thing. It stinks. And people are starting to wake up left and right to the illusion that it is. The fact that all the data is manipulated and faked. All of it. The whole thing stinks from top to bottom. But yet people will still play along. And you know why? Because they made it attractive to play along. You don't want to be the social pariah. And yeah, it's not so bad for some folks. Okay, although they can't go to work, they could sit home and collect unemployment, plus an extra $600 a week on top of that. So they're making out better by staying home, and they have more free time. They could do more of the things they want. They're giving out stimulus money. People are spending money now like they haven't been in years, just because it's, they view it as free money, even though it's just our money they've been taking from us all along. They're giving us a little bit of it back. But it's all an illusion, and it needs to stop. And people need to stand up and say, no, I'm not going to put up with this. This stops now. We're not going to listen to your silly mandates. Because eventually, these silly little mandates, things like, oh, wear your face mask and stay 6 feet apart from everybody, put up plexiglass shields, this is going to turn into take the bio-robot, take the nanobot, take the nanobot injection, attach your brain to the internet, submit. That's what it turns into. It's the ultimate control system, folks. And that's what it's all about. And it's going to turn into a complete panopticon artificial intelligence control grid. That's what the plan is. That's what they're rolling out. And it all has something to do with a little something called transhumanism and the transhumanist singularity. And that's what the controllers of this world are into. Make no bones about that. This is an old occult philosophy that ties all the way back into ancient times, back to the ancient mystery schools. And it's brought forward today, and they see this idea, this great work, so they call it, closer to fruition than ever before. And they see that through the use of these high technologies and these advanced technologies. Make no bones about that. They want to become God in no uncertain terms. They want to live forever and be immortal and merge their consciousness with machines and be able to control it all and totally invert the natural system into something totally unnatural that they could control. And that's what's going on all around us, and people need to wake up to this, be wise to it. No, this is the ultimate plan. And it sounds totally nuts. I know that, but I could show you paper after paper after, policy paper from think tank groups, the real people that control this world, folks. I can show you all these different papers and stuff that are all pointing to the same thing. They've been planning this for at least decades or centuries. At least, bare minimum. So, and you could look all the way back and see the hallmarks of this going all the way back as far as written records could be obtained. So, and that's another thing they're doing. They're trying to erase our history because they don't want people wise to this, that this whole thing's been planned all along, that this is what they're doing. And they're going for broke right now. So, this is what it's about. But anyway, guys, thanks for joining me tonight, and I hope this sheds a little light on the situation. Do a little bit of your own research on this stuff. Take a look at it, because it's out there, It's very real, and people need to be aware of it and put a stop to it before, you know, the next thing you know, you wake up and you're living in George Orwell's 1984. Because that's where it's heading, and it's heading to that on steroids. It's gonna be pretty dystopian if it keeps going the way that it is. But we could turn it around, and people are more apt to listen to this type of stuff than they were just a mere 6 months ago. So people are becoming wise to this stuff. So we need to stand up now, speak up, make sure our voices are heard, and we could actually turn this whole thing around and maybe make something good out of this rather than wind up with the dystopian future that the controllers have in mind. So anyway, guys, thanks for hanging out with me tonight. This is Wayne, Alchemical Tech Revolution, signing off.